Before taking Kaletra, make sure to read the medication guide and patient information leaflet provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once or twice daily. Swallow the tablets whole, and do not crush, break, or chew them. The dosage of Kaletra is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. For children, the dosage is based on age, weight, and height. Once daily dosing of this medication is not recommended for children younger than 18 years old. If you are taking didanosine in addition to this product, you can take it at the same time as this product, but take them both without food. Remember to continue taking Kaletra exactly as prescribed by your doctor and at evenly spaced times every day. Do not take more or less of this drug than prescribed or stop taking it, even for a short time, unless directed to do so by your doctor. Doing so may cause the amount of virus to increase, make the infection more difficult to treat, or worsen side effects. Common side effects of Kaletra may include diarrhea, nausea, vomiting, stomach upset, gas, headache, and trouble sleeping. If any of these effects persist or worsen, please inform your doctor or pharmacist promptly. Remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. As your immune system strengthens, it may start fighting off infections you already had, potentially causing disease symptoms to return. You may also experience symptoms if your immune system becomes overactive. This reaction can occur at any time, either soon after starting HIV treatment or many months later. Seek medical help immediately if you experience any serious symptoms, including unexplained weight loss, severe tiredness, muscle aches or weakness, severe or persistent headaches, joint pain, numbness or tingling, vision changes, signs of infection, signs of an overactive thyroid, or signs of a nerve problem called Guillain-Barré syndrome. Contact your doctor right away if you experience any serious side effects, such as persistent nausea or vomiting, increased thirst, confusion, stomach pain, yellowing of the eyes or skin, or dark urine. Seek immediate medical help if you experience symptoms of a heart attack, severe dizziness, fainting, or a fast or irregular heartbeat. Changes in body fat may occur while taking this medication, and it may also cause an increase in blood fat levels. Discuss these potential side effects with your doctor, and consider the possible use of exercise to reduce these effects. While allergic reactions to this drug are rare, seek medical help immediately if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. If you are in the U.S., contact your doctor or report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before taking Kaletra, make sure to inform your doctor or pharmacist of any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history with your doctor before using this medication, especially if you have a history of liver disease, diabetes, pancreatitis, high blood fat levels, heart problems, bleeding problems, or previous infections with certain diseases. Kaletra may affect the heart rhythm, so it's essential to inform your doctor of any heart conditions, family history of heart problems, or any drugs you are currently taking that may also affect the heart rhythm. Additionally, low levels of potassium or magnesium in the blood may increase the risk of heart rhythm issues, so be sure to discuss any other medications or conditions with your doctor that may contribute to this risk. If you are an older adult, you may be more sensitive to the side effects of Kaletra, so it's important to discuss this with your doctor before use. For pregnant individuals, it's important to discuss the risks and benefits of using Kaletra with your doctor, as treatment can lower the risk of passing HIV infection to your baby. Lastly, if you are breastfeeding, consult your doctor before using Kaletra, as it can pass into breast milk and potentially transmit HIV. It's important to be aware of potential interactions with other medications when taking Kaletra. This includes certain HIV medications, products that affect the removal of Kaletra from your body, and medications that can be affected by Kaletra. Your doctor and pharmacist should be informed of all the products you use, including prescription/non-prescription drugs and herbal products. It's important to not start, stop, or change the dosage of any medicines without your doctor's approval. Kaletra can also affect the effectiveness of hormonal birth control, potentially causing pregnancy. If you are taking hormonal birth control, talk to your doctor about additional or alternative reliable forms of birth control, and use an effective barrier method, latex or polyurethane condoms/dental dams, during sexual activity to decrease the risk of spreading HIV to others. If you experience any new spotting or breakthrough bleeding, it may be a sign that your hormonal birth control is not working well. It's also important to note that many drugs besides Kaletra may affect the heart rhythm, QT prolongation, including pacritinib, among others. Be sure to discuss any concerns about potential interactions with your doctor. If someone has taken too much Kaletra and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of an overdose may include changes in urine output, numbness or tingling in the arms, hands, legs, or feet. Remember, it's important to seek medical help if you suspect an overdose. It's important not to share Kaletra with others. While taking this medication, you may need to have lab and/or medical tests, such as liver function, blood count, blood cholesterol/triglyceride levels, and blood sugar levels. Make sure to keep all medical and lab appointments and consult your doctor for more details. Kaletra is available in tablets, capsules, and oral solution. If you need to switch types of this medication, make sure to get instructions on how to do so from your doctor. Remember to take this medication as prescribed by your doctor and at the recommended times. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Kaletra, it's best to keep it in its original container at room temperature, away from light and moisture. Make sure not to keep it outside of the container for more than 2 weeks, especially in humid areas, and avoid storing it in the bathroom. It's important to keep all medications out of reach of children and pets. When it comes to getting rid of Kaletra, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.